My name is Justina Kopek, and I am one of the EMR engineers here at Microice Technology, and I also have Vida Giacomovic with me, who will take over the presentation a little bit later on. Public Health Reporting, Meaningful Use Core Objective number 10 in 2016. Today we are going to cover the topic of Public Health Reporting, which is your Meaningful Use Core Objective 10. This presentation will focus on Stage 2 in the reporting year of 2016. However, the requirements for Stage 1 differ only slightly, so if we have anyone in attendance that is reporting Stage 1 in 2016, let us know at the end of the presentation and we will touch upon the differences. Just as a refresher, you will only be on Stage 1 in 2016 if 1. You have never attested to meaningful use before, or 2. You have attested to Stage 1 in 2015 or any year previously only one time. If you are unsure about either of those points, I advise you to log into ehrincentives.cms.gov and navigate to the Attestation tab, where you will be able to see how many times the eligible provider has attested before. Measure options. So Core Objective 10 is comprised of 3 total measure options: the Immunization Registry, Syndromic Surveillance Reporting, and Specialized Registry Reporting. You can think of the Specialized Registry Reporting as kind of a master measure. There are a lot of different specialized registries that are contained within that one objective. And in 2016, any eligible provider must choose 2 of these measures to report within the public health reporting measure in order to pass it. So a lot of providers have been thinking that because they don't administer immunizations or collect syndromic surveillance data, they are excluded from this objective. That's not true. If you claim an exclusion from immunizations and syndromic surveillance simply because you don't administer or collect the data, or because maybe your state is not receiving that data electronically from eligible providers, you still have to try to meet the specialized registry reporting measure. So the requirements for Core Objective 10 are that you must register with 2 of these public health registries by February 29th. You also have to try to follow the procedures to engage in active engagement with those registries. And there are exclusions that apply to each of the public health registries. We will go over what the exclusions are in detail specific to that measure. So the first one is Immunizations Registry. Each state has their own Immunizations Registry. Some have multiple registries in different districts. For example, Chicago is one of those. California also splits their registries by county. So make sure that when you're looking up your state's registry on their website, that you're looking at the correct location that your practice is in. If you're not sure how to search for your state's immunization registry, you can try typing your state and immunization registry into a Google search and it should come up. Otherwise, if you're not comfortable with that, you can just open up any web browser and go on www.immunize.org/states, which is the URL that we have up on the screen here. And you'll have to look for the meaningful use section. It will bring you directly into your state's public health registry, but there are specific sections for meaningful use that dictate what the requirements are to meet the measure. So a little bit later on, Vida will actually take you into one of the state's registry's websites and show you how you can navigate it to find the meaningful use section. So exclusions for the Immunizations Registry, there are 3. If you do not administer any immunizations in your practice, including flu shots, you're automatically excluded from immunizations. If your state is not ready to receive the immunization data electronically, you're excluded. And if your state is receiving immunization data electronically but not according to the specific standards defined by CERT, which stands for Certified EHR Technology, then you are excluded as well. This means that CMS has defined that the rule for the public health registry reporting is that all the data that's submitted electronically to these registries is in HL7 2.5.1 format. Your state may not be on that level yet. Perhaps they're on HL7 2.3.1. In that case, you would be excluded from immunizations. When you're on your website and if you do find that your state is not receiving that information or it doesn't qualify because it hasn't met the specific standards, make sure that you take a screenshot of that information with the date at the bottom right corner of the screen and save that in your meaningful use folder. If you do get audited, this will be your proof to the auditor. So the action is, if you do administer immunizations and your state does accept that data electronically, what should you do? First, register on the state website and enroll for meaningful use stage 2. After that, the registry should reach out to you and tell you what the next steps are to submit a test file and then ongoing data eventually throughout the year. Maintain contact with the state and microeyes on procedures for establishing an active interface. If your registry does not reach out to you within, let's say, a week of you registering, you will want to send an email to them and ask them what the next steps are so that it's within the reporting period. If you leave it at just registering and don't try to maintain contact with them and they haven't reached out to you, and an auditor comes along, they may say that you have not tried to engage in active submission to them, or you haven't tried to submit the test file to them, and perhaps they will fail you for that. So make sure that you are the one that tries to reach out to them if the state hasn't reached out to you. And then also, of course, take a screenshot of the email that you're sending to the state so that you can prove that you have reached out to them within the time frame. And as I've said, store all communications in a folder. So if you are going back and forth with the registry on what should be done, make sure that you're saving all that communication in your meaningful use folder so that you can refer to it in the future if you need to. Syndromic surveillance reporting is your second measure option. Exclusions vary by state, so some states may collect data from urgent care centers while others collect from eligible hospitals only. So be sure to check your public health website to see exactly what your state is looking for. And each state also defines syndromic surveillance data differently. So some states may say they want chlamydia information. Other states may say they want flu shot information. Make sure that your provider is not collecting the information that your state is looking for in order to qualify for that exclusion. What the exclusions are, similar to immunizations. If your eligible provider is not in a category for which the state is collecting syndromic surveillance data from, then they are excluded. So for example, the state of Washington is not interested in syndromic surveillance data from specialists. Most of the state websites should have a letter from the national coordinator that says this. If you do find such a letter, make sure you're saving that in your meaningful use folder. If your state does not have the capability to receive electronic syndromic surveillance data, you're excluded. And again, if they're not receiving the data according to the specific standards, then you're excluded as well. And these will be HL7 files, just like immunizations. Action steps: if you do collect syndromic surveillance data and your state accepts it electronically from eligible providers, are register on the state website and enroll for meaningful use stage 2, maintain contact with your state and microeyes on procedures for instituting the regular reporting, and store all communications in your meaningful use folder. And then the last one, most popular for 2016, is the specialized registry reporting. So the specialized registry reporting, like I said, combines a lot of different kinds of registries. There's case reporting, there's national quality clinical data registries, there are electronic reportable laboratories, surgeon registries, there's specialty societies that your providers may be a part of that are collecting information for meaningful use stage 2. So if you are excluding from immunizations and syndromic surveillance, your goal is to do as much research into specialized registries to see which two your provider can report on. Okay, so the registration for specialized registries really varies per registry. Some may want all your practice information and go into detail. Some may be very simple. It may require 2 registrations, may require registration per provider in your practice, maybe a bundled registration. So you really need to do some research into the registry that you're interested in to see how you have to go forth with that registration. Cost also varies per registry. Some registries will ask you to pay per provider. Some registries, it will be a bundled cost as well. So look into that. There are varied reporting methods. Some of the registries are looking for you to upload CCD files that clinical is able to export and upload them onto their website manually. That can be twice a year, or it can be more often throughout the year. It, again, varies per registry. As always, with the other ones, you want to maintain communication with this one too and store all of that communication in your meaningful use folder. There are exclusions if your EP doesn't diagnose or treat any condition associated with or collect relevant data for that is collected by a specialized registry. You can be excluded. Be careful when you are thinking that these exclusions apply to you, because by claiming that exclusion, you're stating that you have done all your research into possible registries out there related to your specialty, and there's really nothing that you can choose, whether that registry isn't collecting data for meaningful use stage 2 or it doesn't exist. And if they're not collecting data for meaningful use stage 2, you want to make sure that you have proof of them stating that, whether it's an email from that registry or you've been on the website and they've stated it on the website. In that case, you want to take a screenshot which shows that you've done this research prior to the 29th of February and they haven't been accepting it. The second exclusion is the specialized registry for which the eligible professional collects data or diagnosis treats collects data is not ready to receive that data electronically. And the third is the specialized registry for which the EP collects data or diagnosis or collects the data is not being collected according to the specific standards by CERT. Action steps: if you do find a registry for which your provider is collecting data, make sure that you register on that specialized registry's website and enroll for Meaningful Use Stage 2 2016 by February 29th. Make sure that you maintain contact with that specialized registry and micro-eyes on procedures for instituting. Any of the registries collect data differently, so you may need some training on how to export CCD files from your EMR. CCD files are just basically chart summaries or complete patient charts, which you'll be submitting to that specialized registry, and then they will be picking that chart apart to pull out the information that they're looking for. And of course, store all communications in a folder on the server with regular backups. What is active engagement? It can be any of the following 3. As long as you've completed registration before the 29th and have intent to submit data, then you are in active engagement with the registry and you have been compliant with Core Objective 10. If you're already in the testing and validation phase, then that's even better. You're moving forward towards production, which is the third kind of active engagement. And production is when you're validated and you're electronically submitting the data to that registry. Eventually, the goal is for you to be in production with the registries. So when you're choosing these, you will be reporting to them not only in 2016, but in 2017, 2018, and ongoing. What they're going to be collecting is, if anyone is familiar with clinical quality measures for PQRS, most of these registries are going to be looking to collect data for clinical quality measures as well. And that can be a specialized registry may be collecting data for a set of podiatry, let's say foot-related measures, or they can also be collecting data for diabetic-related measures. So if you're not sure whether you're collecting or treating patients with the data that a registry is looking for, send an email to that registry and ask them for the PQRS numbers of the measures that they are collecting data for. They'll give them to you. If you just do a Google search on that measure number, you will be able to see exactly what that measure is defined as and determine whether your provider is diagnosing patients with that. Okay, so now I'll hand it over to Vida, and she'll show you how to navigate through the registry sites.
Thank you, Justina. Okay, so I know that it can be challenging for the providers to find whether or not their states are ready to accept not only the immunization and the syndromic surveillance data, but also to figure out if you are going to report to the registries which ones you should submit to, which ones are ready to collect the data, and which ones are not. So what you can do first is we've put here a website for you to use. We can mail this out. We can mail out this PowerPoint. We'll also have it up on our website. If you access this link, this will take you into a website that will give you a brief snapshot of whether or not each state is ready for immunization, syndromic, and registry reporting. So the website that you're going to access is going to look just like this. It gives you a little bit more information about the successful ongoing submission, so you can read up on that. It's basically what Justina just reviewed. But if you scroll down a little bit further, there will be a table here that will list each state. And going across at the very top, it will list each of the measures. So starting with the IZEH, that stands for immunizations for an eligible hospital. Moving over to the right, you will have IZEP, that stands for immunizations for eligible professionals. So if you are an eligible professional and you do administer immunizations, you will want to find your state over on the left-hand side and see whether or not they're ready to accept immunizations. For example, Connecticut is not ready to accept immunization data from eligible providers. However, if you scroll down further to some other states, a lot of these states are, in which case you will want to engage your state's public health agency or the Immunizations Registry, excuse me, and get in contact with them to start reporting towards this ongoing submission. Furthermore, this link kind of helps you out in that on the left-hand side, the state is a hyperlink, so if you click on the actual state, it will take you, in most cases, into the state's public health website, where you can then navigate to the Immunizations Registry and syndromic surveillance data. Okay, so if we go over to the right-hand side of the immunizations, now we start looking at the syndromic surveillance, same kind of a breakdown where you have syndromic surveillance for eligible hospitals versus syndromic surveillance for eligible providers. So you can determine whether or not your state is ready to accept this data. Now, in some cases, you will notice that it says a yes next to it. However, it may be because the state is collecting syndromic surveillance data from primary care physicians only. They may want that data just from them and not want the data from a specialist. So even though it says yes, you'll kind of want to look into it a little bit further and see if they actually want the data from your specialty. And again, you can access the syndromic surveillance or navigate to the syndromic surveillance by using the hyperlink on the actual state. And then going over to the right of the syndromic surveillance, you have your registry laboratory reporting, cancer reporting, and specialized registries. I would encourage, if you are thinking of reporting for any of these three, I would encourage you to go into maybe individual registries rather than relying on this website, just because the information is changing so fast and there's so many registries that weren't able to accept the information before but are now capable to accept, and you also don't want to rely on the specialized registries just for the state, because there are national registries that you can report to. So one of the other documents that we can provide you with is a national registry inventory. If you do request that from us, and we may also post on our website, the document will look just like this. So if you scroll down this list, you will have the different registries listed, and over to the right-hand side, you'll have their links. So if you go into any of these links, you'll be able to either contact the registry or maybe navigate to the Meaningful Use section directly and find out whether or not they're ready to satisfy the meaningful use requirement and collect the data. Unfortunately, there is no magical recipe to finding the registry that you can report to. This is something that we've been doing internally as well. We've been going down this list and contacting the registries. So what you'll want to do first is looking over on the left-hand side and into the affiliation and the clinical registry name and focus, you'll want to determine whether that's something that you actually perform. For example, if you are an otolaryngologist, you can maybe submit to the American Academy of Otolaryngology. So it really varies, what your focus is and what your specialty is. This document is really long, so you'll want to pick out the ones that you can potentially report to first, and then you'll want to actually go into their website, which is over on the right-hand side. You can either copy and paste it into your browser, or in some instances, depending on whether you're using Internet Explorer or Chrome, it may let you click on it and link into it directly. But once you're there, you'll want to find a section that refers specifically to meaningful use. So in other words, you'll want to find some sort of verbiage on the website that says that they're compatible with meaningful use core objective number 10 reporting. And the registries that are will typically have it on their site. If you're not sure and it's something that you'd still like to report to, you'll want to contact the registry via email. Make sure, like Justina mentioned, you keep track of all those emails. So if you sent an email to them, keep a log of when you emailed, save it somewhere in your outgoing mail outbox, and maybe even star it in some way, so that if you don't hear back from them, you have a record of it. Also, if you do hear back from them, make sure you store that communication as well. So it is a lot of research, unfortunately. It's not something that we can just kind of guide everyone, because again, it depends on what kind of information you collect. For family medicine, just from the research that we've done, for family physicians, you can, for the most part, use either the Genesis Registry or the Dartnet Practice Performance Registry. So the Genesis Registry will collect, and it's, by the way, on that document. So I can go into it, and here's our Genesis Registry. If you visit their website, you'll see that they collect a wide array of data. So it could be anything from tobacco smoking, an intervention, to BMI plan, an intervention. They do some preventative measures, such as collect whether or not the patients have had their pneumonia vaccinations done. So they do collect a very wide range of data that not only the family physicians but specialty practices could use as well. So if you're really unsure, and if you're really at a loss of what registry to report to, and you are a specialist, you could also use the Genesis Registry. However, we do encourage you to maybe use something that's a little bit more specific to your specialty, because the whole point of a registry is that it's supposed to help you grow your practice. It's supposed to let you know how you're doing, how your performance is compared to other physicians with regard to your specialty. So while you can use this, reporting a single measure to a registry will satisfy the meaningful use requirement, as long as the registry is specialized and certified for meaningful use. And again, you'd find that on their website. So while you can report just a single measure, typically, you'd probably want to find something that's a little bit more geared towards your specialty from this list. Another registry that currently, again, for the most part, collects just the family and the internal physician data would be your Dartnet Practice Performance Registry. This registry in particular, again, you can find it on the sheet here, and you can read up more about it if you go onto their site. But what they do is they pretty much compare your performance to performance of other physicians in your area. And they give you graphs and charts so that you can see how you compare to these other practices. If you are a podiatrist, you can register for the wound registry. Unlike with most registries, where you register for one registry and you have to still register for another one, the wound registry kills two birds in one stone, in that if you register for the wound registry and are a podiatrist, they will automatically register you for the podiatry registry as well. So if you're a podiatrist, you can register for the wound registry, and that will meet your entire core number 10 objective. However, again, if you're, if you're a practice, if you're a family or an internal or any other specialty, you'll typically want to find two registries. If you're a family physician, it could be your immunizations and then a Genesis or Dartnet. If you're a different specialty, you'll probably want a Genesis and maybe something else. So again, unfortunately, there's no formula for picking these. It's a lot of research. You'll want to look through this list, find what you could do, and then go onto the websites, find out whether or not the registry is certified for core objective number 10 reporting. And if you don't see anything on their website, we do encourage you to reach out. There is not a lot of time left, so if you don't hear back from the registry within a couple of days, email another one. In fact, what we recommend doing is, just go through the list, pick out the ones that you could do, and contact them all right away. So don't wait, because you are running out of time, and unfortunately there are no leniencies. So if we don't register before the end of the month, you're likely to be failing meaningful use. Okay. For those of you who've already missed the or for those of you who've already missed successful attestation in 2015, whether it was because you didn't have a public health objective that you needed, or maybe for some other measures, there is a hardship exemption that you can still claim. You can find it on the CMS website, or you can also find it using the hyperlink that we've inserted here. So if you did not successfully meet meaningful use for one reason or another in 2015, you still have an option to file a hardship exemption so that you wouldn't get the Medicare cuts in 2017. Okay, so at this point, we don't see any questions pending, so we will end our webinar. If you have any questions, feel free to email us or reach out to MicroEye support, and we can guide you, a little bit further. Thank you very much.